if you really look at the numbers, as it were, if you take a depressed patient who's never been depressed before and who comes to your office and says, look, I can't stand the way I feel. I've tried therapy for a few weeks. It's not doing any good. I can't function at work. I'm getting really negative, horrible thoughts about wanting to die. Help me out. Okay, you give that person an SSRI, and the odds of that drug helping that episode of that condition, the first thing that you give them, is about 30%. You maybe you'll get 50% who actually say they feel better, but of that group, about half are going to stop it because it makes them feel dead inside, kind of emotionally not there. It causes sexual dysfunction, including inability to orgasm, sometimes actual erectile dysfunction in men. And by the time you're done with that list of things, you're down to that core group of 30%. Then you give them a second drug, and you pick up another 20%. But by the time you're done, let's say after a year of treatment, you have successfully treated about 80% of people with the depressive episode. And yet, when you say successfully, of those 80%, maybe half, 40%, are really in what we would call a good remission from their illness and will go on to lead pretty reasonable lives. The other 40% are in a kind of a semi-remission where they're at risk for further episodes, where they have to stay on these drugs for extended periods of time, and where the patients aren't that happy about it. That's where we are today.